Smell disorder is a problem a person has with their sense of smell, which can range from loss of sense of smell through to distortions of smell, or sometimes a sensation that a smell is present that no one else can detect, so that's something that's not in the room or the environment around you. So we call these things anosmia for total loss of smell, parosmia for distortion of smell, and phantosmia for imagining smells that aren't actually present. Yeah, so taste medically refers to the sensations of salt, sweet, sour, bitter, and umami that we get from the tongue. So a taste disorder is typically either a loss of sensing those key taste modalities, or sometimes, again, a distortion of one of those. So some people might complain of a salty taste or a metallic taste in the mouth. And that's what we call a true taste disorder. So the number one cause of smell disorders is chronic rhinosinusitis, which is a condition that where swelling occurs in the nose and sinuses. It typically creeps up on people over several years. And there are generally sort of two main forms, those where polyps form and those where there are no polyps forming, but just general swelling throughout the nose and sinuses. Beyond that, then the next most common cause, and probably now increasing in number in the UK and around the world, is of course viral infections, and we've seen that specifically with COVID-19, and we estimate in the UK that there are now perhaps close to 1 million people with a persistent loss of smell and taste, or distortion of smell and taste as a result of COVID-19 viral infection. Beyond that, then head injury and smell loss without any apparent cause are probably the next two most common things that I see in clinical practice. So the first thing really is taking a clear history from a patient, understanding the timing of the onset, any potential triggers for when it started, understanding any other symptoms they have from their nose, from their mouth, and understanding their medical history, that whether maybe anything that's relevant in terms of other medical diseases or any other medications they're taking. And the next most important thing is to examine the nose and determine whether there's anything in the nose that's causing any blockages, any distortions. And then after that, we have to perform smell testing and or taste testing to understand how that patient performs. There is a key disconnect between how people perceive their senses of smell and taste and how they actually perform on testing. So that's a really important step. Beyond that, really, it depends then on the history examination and smell test as to where you go next with any investigations. Some patients may require a scan. That might be a CT or an MRI scan. Some patients might require some blood tests. Some patients might simply require then a treatment pathway that needs to be mapped out according to their particular case. I wouldn't ever say anyone's curable, but certainly some conditions are treatable. The most treatable cause of smell loss is chronic rhinosinusitis, and certainly with regular maintained treatment, patients can often get significant improvements in their symptoms, including particularly around the sense of smell. Other smell and taste disorders vary in terms of their treatability, and not just much just on the cause, but also often on the individual cases. So that's really where all the assessment part comes in, to understand what the likelihood is of recovery and how treatable it can be.